Hi everyone! Today we will be showing you 3 different dynamic stabilization exercises. These exercises will help activate the muscles that stabilize the shoulder girdle and make a great warm-up before beginning more intense strengthening exercises or sport-specific play. One of these 3 exercises should be incorporated into your routine on any given day. Each exercise should be performed 1 minute per arm and can be performed with either a stability ball or a TheraBand. These exercises can be progressed by increasing the time of the exercise, increasing the weight of the ball, or increasing the resistance of the band. These exercises can be regressed by decreasing the time performing the exercise, decreasing the weight of the ball, like using something like an inflatable beach ball, or decreasing the resistance of the band.
These dynamic stabilization exercises should fall between a 12 and 15 on the RPE scale. If the athlete identifies the intensity of the exercise below a 12, then the exercise is too easy and should be progressed. If the exercise is above a 15 on the scale, then the exercise is too difficult and should be regressed. The first exercise is in what we call the 90-90 position. The shoulder is raised to 90 degrees of abduction and the elbow is bent to 90 degrees of flexion. The shoulder is externally rotated so that the palm is facing forward. The wheelchair will be positioned facing the fence and may require assistance from a friend or coach or a block to prevent backward rolling of the chair. The chair should be as close to the fence as possible to allow proper positioning of the arm. The ball is then going to be bounced against a wall or fence for 1 minute. It is a continuous, rhythmic motion. The motion should be driven from the shoulder and not the wrist. This position is great for tennis athletes because it mimics the position of an overhead hit or serve in tennis. If you do not have a ball available to use for this exercise, it can also be done using a TheraBand. To set this up, position the wheelchair facing away from the fence and attach the TheraBand slightly above shoulder level. Grip the TheraBand and position the arm in the 90-90 position. Make sure the wheelchair is far enough away so there is adequate tension in the TheraBand. Work in a small range of motion to activate scapular stabilizers just as you would with a stability ball. If the athlete has difficult gripping the band or has limited grip strength, you can tie a loop at the end of the band and put it around their wrist. The second dynamic stabilization exercise is performed in an overhead position. The shoulder is positioned in full flexion, otherwise the exercise mimics the previous one exactly. In this position, it is common for athletes to shrug their shoulders up towards their ear or drop their arm out towards the side as they fatigue. Maintain proper positioning throughout the exercise to ensure activation of the lower trapezius and other stabilizing muscles in the overhead position. This exercise can also be performed using a TheraBand. For this, the wheelchair should be facing away from the fence and the TheraBand should be attached at a higher level than the previous exercise, in line with the hand when the shoulder is in full flexion. Again, you can tie a loop in the band and place it around the wrist if the athlete has limited grip strength. The third exercise in this series is called protracted circles. The positioning of the wheelchair will, again, mimic that of the previous 2 exercises. The shoulder is flexed to 90 degrees, the elbow is extended, and the scapula or shoulder blade is protracted. This motion will look similar to a forward punch. Make sure that this motion is coming from the shoulder girdle and not from rotation of the trunk. Once in this position, draw small circles with the ball for 30 seconds in the clockwise direction and 30 seconds in the counterclockwise direction, with no rest in between. This exercise specifically targets the serratus anterior muscle, which helps move and stabilize the shoulder blade. If this muscle is weak, it can contribute to dysfunctional overhead motion. This can be done with a TheraBand as well. For this, the wheelchair will be facing away from the fence, but the TheraBand will be attached only slightly above shoulder level. Create adequate tension in the band by adjusting the distance between the wheelchair and the fence, and continue with the protracted circles, 30 seconds in each direction.